There seems to be a new development when it comes to the impact of COVID-19 in the U.S. And BNC's chief medical editor, Dr. Corey Hebert, is joining me now to talk about all of the new information concerning the virus. Good evening, Dr. Hebert.
Good evening. How are you?
Doing good, Dr. Hebert. So, obviously hearing those numbers is very unfortunate. It's sad to hear that. There's now a push to get more pregnant women vaccinated to help prevent hospitalizations and deaths. Many women are concerned it could actually harm their babies. What would you say to them?
Well, one thing we always have to look at is the risk-benefit ratio, right? So if you've had 8 women that have died from COVID-19 infection that are pregnant, then you have to start thinking about what would be the worst case scenario. Now, we know that Black women have the highest rates of death during pregnancy in the United States over any other group. Some of these rates are higher than in third world countries because of many reasons. We've had all types of exposés on it. Maybe people feel like that what we've seen in the data is that they say white doctors and white institutions that are hospitals just don't take care of Black women as well. Now you throw this statistic into the deep South, like Mississippi, which has one of the highest rates of physician and healthcare disparities in the country. And we don't really like to say the word disparity when we talk about how patients are being taken care of, because it's really an inequity, not necessarily disparity. Disparity just means different. Inequity means unequal. Right. So with all these things teamed up, right? So we have Mississippi, we have Black women dying anyway, and more than anybody else. And now you throw COVID in the mix, then the situation is you need to get vaccinated, because if you don't, you already have all the things that are against you as you get pregnant and have a baby.
And Dr. Hebert, what about hospitals? They're reporting stillborn babies and more premature births due to mothers with COVID. Can you put that in perspective for us when you talk about why that may be happening?
Sure. Yeah. When you have a viral infection, even we talk about like rubella, right? We talk about the measles, mumps, rubella, the MMR shot. Rubella is one of those vaccines that we use so that these things don't happen. So the fact that viruses do this is nothing new, because rubella is a virus. That's why we get the vaccination. That's why pregnant women need to be sure that they have their rubella vaccination and they are immune. So the issue is that it's not about the virus. It's the fact that the viruses have always been there. They're always going to be there. And if you start seeing some that are causing this more, we know that we haven't seen babies stillborn and babies really, really sick when they are born from women that have had the vaccination. And that's one of the real disinformation things out there, that people say more people are dying from the vaccine than from COVID-19. And that's just blatantly false. That's just a lie. We know that 94% of the people that are in the hospitals right now that have died are unvaccinated people. That's just a fact. And we really can't gloss over the facts. I'm tired of just, saying that, oh, well, we need to just say this very clearly and say it very nicely. We don't really need to say it very nicely. We need to say the facts. And the facts are that if you don't get a vaccine, the odds of you dying from COVID-19, whether you're pregnant or whether you're not pregnant, is much higher than if you did not get the vaccine.
Yeah. And at this point, it's just kind of like we're saying prayers for those moms and those precious little babies out there. But also, Dr. Hebert, the FDA's panel approval of a third dose to America's seniors, why is the third shot okay for them now and not for other Americans as well?
Okay, so this is kind of a little bit of a moral dilemma. And as Black people, we really need to think about it, because we know that a lot of the variants come from other places in the world. We don't really have a lot of United States variants because we're very highly vaccinated. So if we have other places in the world that have not gotten one shot, like some places in Africa have not gotten one shot. So you look at all those places, those are where the variants are going to come from, because that's where the virus is running rampant. So if we have people in America and we just say we're going to give all Americans a third dose, that means not only have we had 1, 2, now we're going to have a third. So that's protecting us, but it's not protecting us against the variants that are coming from the other places. So we're kind of shooting ourselves in the foot by not giving the other vaccinations to the other parts of the world. It's a very hard decision to make. But what I will say is that what I think should happen, and what I think that they're trying to do, is people that are over the age of 65, people that are in nursing homes, people that are work in hospitals, people that have high risk, people that are doctors, nurses. These are the people that got the first dose of the vaccine anyway. Give them the third dose, and then let everybody else just kind of wait until we can kind of vaccinate the world, because it's called a pandemic for a reason. If it was an epidemic, it'd just be the United States. Pan means world, and we have to take care of the world, even though sometimes it's a bit of a burden.
And Dr. Hebert, before we let you go, I want to know, I'm curious, what message would you send to unvaccinated? Because this week, celebrity Nicki Minaj put out a tweet talking about do your research before you're vaccinated because of, something that allegedly happened to a family member. What do you say about that?
Sure. I will say we just cannot listen to pop culture icons when we're talking about health. We just can't, and we shouldn't listen to anybody, not our cousin, not our friend, not our anybody, except somebody who has done multiple years of study in vaccinology. That's just it. Because I'm fighting people every day all over social media asking me questions like this: why we have to keep getting boosters? That means this vaccine doesn't work. That's one of the questions I got today, and I said, because babies get boosters at 2 months, 4 months, 6 months, 12 months, 4 years, 11 years, and 16 years. The same vaccine all those times. So why are you tripping? And the reason why you're tripping now is because you didn't know that, because you don't know anything about vaccinology. So just stay in your lane. Whatever your job is, do it well. And I'm not going to be egomaniacal enough to think that I can come to your job and tell you what to do. Let us do our job like you've always let us do, and live peacefully. And that's what you'll do, because ignorance is bliss, and that's what people have had for the last 30 years about this stuff. But they were sitting at home watching this every day because they weren't going to work, and now they're like, oh, I'm a side hustle scientist, and that's just not how it works.
All right, we got it. Dr. Hebert, we appreciate you. Thank you for joining us tonight.
Thank you. Thank you.